So Sarah is WOW Circus Skin's Global Operations Director. So not only does she help with the processes and the systems that we run here in the UK, she deals with a lot of like the imports, the exports, and the distributors that we have for Kaisense in particular. And she's going to talk about a very important topic today, and it's one that I don't particularly love, but I understand its importance, and that is about compliance and regulation and doing your due diligence. So please welcome Sarah.
The reason I wanted to do a talk was we went to a safety and beauty conference, didn't we, Lisa, a few weeks ago, and actually that conference for safety and beauty meant so much more than other conferences I've been to. Like, it was so important what everybody was talking about, regulations, compliance, everything, and it was just a really good conference. And I was really, really nervous. I can feel myself getting nervous again now, but I said to Claire, please let me do a talk, because actually in this industry, talking about compliance, regulatory things, everything like that, it's so important, and people don't realise how important it is. And, you know, oh, nobody's going to know. It's going to put it under the carpet. It's going to be fine. Nobody's going to find out. Well, they will find out, and you will eventually. You know, the government are now looking to bring in more legislations and things like that, and it is going to put you guys and us under pressure. So we've got, anyway, I'm going to touch on it anyway, but I'm going to be talking about ensuring safety, trust and market readiness. So it's making sure that what you're selling, what you're doing, everything that you're about is legal, compliant and safe. End of the day, the patient safety is most important, isn't it, at the end of the day? So I wanted to talk about why I started with the company. So I know Claire talked about it a minute ago then. So when I started, when the business first started, it was just Claire and Danielle, and they were just doing sales. They'd got these products, they were labelling in Claire's living room. You know, I was doing the fulfilment for another company that I worked for, and I got made redundant, and Claire said, oh, can you come and work for me? And I was like, I would love that, but you can't afford me. You're doing great yourself. I'll just do your deliveries from home. It's fine. And I need another job. But anyway, we jumped ship. She went, I can afford you. You've got to come. I need your help. I need your help, basically. I mean, they were doing great. The sales force were great. They'd got loads of money in the bank. They were doing a fantastic job, but they'd got no processes. They weren't looking at legislation complex. Well, you were, because you were, but you'd not got anything written down, and anybody can turn around and go, oh, no, I'm compliant, I'm legal. Prove it. Show me. How are you legal? What are you doing to be legal and compliant? Because at the end of the day, like you said, you're doing treatments on patients, and it's their faces at the end of it, and that's what's most important. So basically, I started, and like Claire said, what process have you got for this then? I haven't got one. So now, when I came in, we've got processes, we've got procedures for absolutely everything. We've got a fantastic quality team, because quality is really, really important to us as well. So we've got a fully operational team. Unfortunately, operationally, my team's bigger than Claire's in sales, but you need an operational team to be able to look at compliance, HMRC, VAT, everything, compliance, down to your labelling, your lot number traceability, your quality management systems. Not a lot of people need quality management systems, but what they do is help you manage your processes. They enable you to grow. So we as a business, I always say to my team, when you're looking at doing a procedure or a process, think big. If you had 1,000, you've only got 5 employees now, but if you had 1,000 employees, would that procedure work? Would that process work? And I know it's a little bit different for you guys, and I can see that Claire's already bored, so I'm going to move on. So luckily for Claire, Richard ran over, so I can talk really fast and get this over with. But basically, we're going to talk about the importance of an ISO certification. The importance of an ISO certification for us as a business particularly, how to check for a valid CE mark, because lots and lots of products out there, loads and loads of products, anybody can put a CE mark on anything, but if you're not verifying that CE mark, it could just be a load of old shit, basically. And you need to make sure that if you are using a product, because you go, oh, it's CE marks, that one, it must be right. Oh, perfect, it's got CE mark. We've had products that we've purchased, check the CE mark, not valid. We've had companies who've tried to work with us, we've got quite a name out there for ourselves. Companies who've tried to work with us and have gone, no, yes, we're ISO 13485, blah, blah, blah. And we go, okay, send your certificate. And we've looked and we've gone, no, you're not. You're really not. That's a forged certificate because you can go back to a notified body. Are you yawning as well, Emma? Oh my God, I'll start dancing on stage or something. Yeah. But yeah, we'll touch on it anyway. Understanding the UK OPSS system. Does anybody know what that is? No. Do you all sell cosmetic products? Yes. You should know what that is then. And how you can effectively do your own product compliant research. So let's move on. So again, we as a company, we are ISO 13485. What does that mean? That means that we are legally allowed to manufacture medical devices. So our certificate actually specifies what medical devices we manufacture and what we distribute. So what that kind of gives you is your processes, your procedures. We get audited every year. We either have a full audit or we just get a surveillance audit where they come in and the auditor will go, right, let's just look at this process, this process, this process. You need to, on that day that he comes in, to be able to go, yep, there's that one. Yep, there's that one. Yep, there's that one. This is the changes, controls that we've been through. This is what we do as a business to make sure that we're following all the procedures. He'll meet with the team and make sure that they understand what it means to run an ISO 13485 company. But anybody who's manufacturing or distributing a medical device should be ISO 13485, 100%. So ensuring our quality systems are compliant with regulatory standards. So any regulatory standards got sections, it's got annexes, it's got guidance, and you need to make sure that not everybody needs a quality management system. We do now, because again, we're always thinking about whatever we do, can we grow? With a quality management system, you can grow because everything's in the system for you. I don't need to think about anything now. We used to have handwritten procedures, a document on Dropbox. Now we've got a system that tells me everything. It shows you all the changes, everything. So it's really important for a company of our size to have a quality management system. It's very expensive, but I sleep at night well. So again, demonstrating due diligence to regulators, customers and partners, ensure traceability, risk management and product consistency. So one of our procedures is our risk management procedure. It's huge, it's massive. Our risk management report is big because we're doing medical devices, you have to make sure that what you're doing is safe. So making sure you're mitigating risk, making sure you're not going to damage anybody at the end of the day. We've got a massive matrix of documentation that actually proves that what we are doing and what we are selling is safe. And also with the lot number traceability, so ensuring traceability and risk management, part of that is the lot number traceability. So you'll probably notice if you purchase anything from us, on your invoice will be an expiry date and it'll be a lot number. I need to be able to, if I have a product recall, be able to tell us or my boss, I've sold this product to this person on this day and I need to recall it, because if there's a problem with it and you're about to put it in someone's face, I need to be able to turn it around quickly. Now we've actually had, So Kysense is a class 3 medical device. We've had 2 product recalls, but they've only been mock ones because the manufacturer needs to know that we can uphold our ISO certification and that we can do it really quickly. And we did it in half an hour, turned it around really, really quickly. And that was me saying to my boss, look how brilliant our team is and look what we've done to be able to turn that around. Luckily, I mean, some of those products have been sold for a month, but we'd just got an issue. It was a fake issue, but, you know, we need to be able to recall those products. Got the data, turned it around that quickly. And that's what you want. You want to start.
Same for you guys. You know, when you're recording your batch numbers of your medical devices, it's so important that you do that.
Yeah.
If there was ever a manufacturer's recall, whilst this was a mock one, if there was a real issue with any of the products that you use, you need to know which patients that's ended up on.
Yeah.
I think we've spoke to this before years ago about that, from factory to face.
Yeah. 100%.
It's so important because if there's something serious, you need to be able to consult your patients about it as well.
Yeah. And again, like I said, you don't necessarily need a quality management system, but you need a system that's got your patient data in there. If you've got a lot number issue, if I come to you and go, oh my God, this hyaluronic acid lot number's got a problem, you need to be able to tell me really, really quickly whose face you've put it in, so that we can call them and go, might not be an issue, but let's come and assess you anyway, and let's work out what, because it could be that it's not going to cause an issue if it goes in the skin, but if it is, we need to be able to turn it around really, really quickly. So demonstrate due diligence to regulators by using quality management systems. So that's what I've just touched on there. So again, having your procedure, even if you work on your own, you've got your own clinic, having a policy and a procedure in place is really, really important. It will help you at the end of the day. So right, how to check. So this is all about checking and validating. If somebody says to you, this product's absolutely fine. Look, it's got a CE mark. Woo, great. Well, has it, and is it real? So go and check and make sure. So any medical devices particularly should have a CE mark on there. Class 2A, Class 2B, Class 3 medical devices, it will be a CE and it'll have a 4-digit code. You can do a search on the Nando database with that number, or if they are CE marked and it's a medical device, they should also be ISO. And when you look at an ISO certification, you can go and check the notified body, go on their website, give them the certificate number, and they'll be able to validate whether that's real or not. We found this out by doing our own due diligence before we started working with certain manufacturers and suppliers, because we found that there are quite a few dodgy people out there who just want to make money from people's faces. And there probably is money to be made, because people, you don't believe me, do you? No, of course not. No, there's some right wankers out there. No, there isn't really. So number 2, verifying declaration of conformity. So everything that we import, and don't fall asleep, Claire, but everything that we import, we do have to have a valid declaration of conformity. Sometimes you need a certificate of conformity, sometimes you need a declaration of conformity. Know the difference. So if you are buying direct from a manufacturer, which could potentially save you money, you've got no middleman, do your research and make sure that what you are buying is okay. And any manufacturer should be able to just give you a declaration of conformity. If it's been imported from another country, or even from this country and made in this country, you should be able to just get that. And if you can't, there's a red flag, and maybe look at going somewhere else. So also you can search the UDMED database. Now the UDMED database is live, but it's just not really fully functional at the moment. And what's happening with that is, because we like to keep ourselves on top of regulations, and we go to Brussels every year to a big conference about this kind of thing. And what came in last year was that a lot of European countries now, just because the UK left Brexit, and a lot of European countries now are actually starting to build their own databases. So rather than having this one place called, the UDMED database was meant to be a big database for everybody in Europe. UK left Europe, and everybody's gone, we could make loads of money. Spain are doing it, Italy are doing it, they're all doing it separately. So there's no one place of truth anymore. But yeah, again, looking at CE labelling accuracy and just making sure that it's right for your products. And like I said, if you can't get any information or the information that you ask for quickly, if you ask a company, they should be able to turn it around quickly if they are legal and above board. If you can't, red flag, look somewhere else. No time for photo shopping. Oh, crikey, sorry about that. But yeah, no time for photo shopping. But we did find we had somebody who was saying that they were the notified body was BSI or something like that, and they'd put the BSI for a country that BSI weren't even in. Do you know what I mean? They'd forged it and messed about with it that much that they weren't even in the right company. Do I need a microphone? I feel like I'm going on and off like that. So anyway, so the UK OPSS system, what that is. So the UK OPSS system is the UK equivalent to what the CPMP is. So the CPMP is custom cosmetic portal for notified products, something like that. And have to have any products that you are selling in Europe and in this country registered on the CPMP. Since the UK left Europe, we now have what we call the UK OPSS. So all of our products, the cosmetics, are all registered on the UK OPSS, and you can't sell products. So I know some of you sell retail products in this country. Go on. Well, you can't, unless you're registered in Europe and you've got a European representative, you can't put it on the CPMP anyway. It will be deleted. If it's under you as a UK business, yes, it'll be deleted. So what we did, when we knew it was going to change, we went onto the CPMP, downloaded all our data, and we were going to upload it, but actually we'd made some changes anyway. So now I've got a fantastic quality team and they deal with all of that. So all of our products are all on the UK OPSS. So if yours are not on there, I suggest you look and get them done, because if, well, who's the responsible person then? The manufacturers, and where are they based? Oh, right, okay, so
I think you just need to make sure, obviously, you need your packaging on the UK OPSS system. Your packaging, your labelling, everything needs to be uploaded onto that as well. So you have your due diligence with releases to go to the manufacturer and ask them if, as the responsible person, have they made sure that your products are correctly entered onto the system, that the packaging is uploaded correctly, and that all that information is on there correctly. That's your due diligence.
Like it's the whole system.
Yeah.
I was responsible for the name.
Yeah.
yeah, I would just check with them. Yeah, like Claire said, just check, because at the end of the day, if you're selling it in your clinic, you are responsible, even if you've not manufactured the product. But yeah,
I see lots of, I don't know if you've seen people set up their own business and they're making their own soaps and their own moisturisers on Facebook and selling them, but they won't be following the correct labelling laws, and they won't be registering on things like this, and they're actually breaking the law, and the fines for it can actually lead up to a prison sentence as well. So you know, if you are ever going to do something like that, so you're making your own lip balm and you're selling it to your clients to those lip treatments, it has to be registered on something like this. And I see a lot of my clinics and customers doing this as well. Oh, I developed my own, post-procedure balm, for example, and they never register it anywhere. That actually is really opening yourself up for potentially criminal records. Or
yeah, and the fines and the UK government don't go easy on the fines either. It's not £1,000 anymore. It'll be a lot more than that. So yeah, just again, this is about you doing your due diligence as well. So if you're buying a product from a company like the Intradermology, for example, all of that is all registered, obviously. It's all on the UK OPSS. Something else that we actually do as well, you might notice, are all of our products, not all of them, but as we're working through them now, they're all registered on what we call GS1. And GS1 is an organisation, it's a free non-profit organisation where it's kind of like UDMED, if you like, but it's a database of barcodes. So all of our products are all registered on GS1 with a barcode. So if you've got a problem, or a customer in a shop has got a problem with a product, they can scan the barcode and it will take them to the product on the system. So again, that's something just really important. It might feel like a really small thing and some people aren't bothered, but I like to sleep at night and I want to know that what we are doing as a business, A, I keep Claire out of prison, and B, I make sure that everything's compliant and that the patient at the end of the day on the bed is safe. So yeah, what we've got next. Again, don't rely on assumptions. Sorry, I'm very conscious. I'm going to try and talk quick because it's lunchtime. But yeah, do your due diligence yourself. Are they registered? If you check the manufacturer, are they registered with a notified body? Is it an approved body? Use the database, UDMED, obviously all the medical devices. So any medical devices we've got are registered with the MHRA. Whether it's a manufacturer or a distributor, they should still be registered. Your UK OPSS for cosmetics and recalls and guidance, and ask for proof. So we have a hell of a lot of documentation. So even just on one shipment, you've got to be able to back up what you're bringing into the country. So down to the technical file is 100 pages long, maybe even more. Your conformity certificates, your risk analysis documents, if you're getting a product in that's sterilised, sterilisation validation certification, there's huge amounts of stuff. Everybody's yawning, right. But yeah, I mean, what you can do as well, so the last one there, talk to compliance experts. There's people out there who are experts in this field and they will help you. So yeah, make sure that you look into all of that. So, that was just saying, so basically just having all of your systems and your processes in place means that you can grow as a company. And it, like I said, we like to sleep at night. I need to know that what we're doing is safe. So ISO, so compliance is not just a box ticking exercise. It's about protecting users, maintaining your reputation and building a business that can last and exist and actually look after people. We all love making people happy, and doing it in a safe way is really, really important. CE and UK CE marks to ensure they meet legal standards and obligations. Understanding the UK OPSS, like we've just said there, Lisa, but I can chat with you afterwards and show you where to go. And it keeps us on the right side of enforcement, because the UK are actually clamping down, and this is why another reason for this talk is because they are clamping down. They are coming for people, they are looking for, and actually unfortunately they're looking for small businesses. So even though we might seem big to some people, we're only really, really small, but we've got an ISO 13485 and we are compliant and we're safe, and we've got a very expensive quality management system, but it speaks for itself. And yeah, doing your own homework, and it'll protect you from costly mistakes, because all it'll take is that one pissed off customer going, I bought this product from Lisa, it's not on the UK OPSS, well, you've got a 10 grand fine at your door quickly, because it is your responsibility. Right, final thoughts. In our industry, like we said, trust is earned through transparency. Any of you want any documentation to back up any of our claims? So even if you have to be really careful when you're doing a cosmetic product as well about your claims. If you're saying it will reduce wrinkles, prove it. Can you prove it? So just recently we ran out of Synergy 6 50ml, because it flies off the shelf. It's a really, really cool product. Everybody uses it, and customs, so business trading and standards held it at customs. It happened a couple of years ago, and we've imported loads since then and they've never took it, but this particular shipment, they must have known I was out of stock because they were really pissing me off. But they took it, and they sent it. So I was just going backwards and forwards going, there's nobody you can contact. I can't just make a phone call and go, you've got my products, what can I do to get this moving? I'm desperate, this is business critical now. I cannot make sales now. My team are coming down on me going, where's the product to sell? I'm going, I'm really sorry. It is actually out of my hands. But we did a few emails, and then they sent an email back going, we need all of this documentation. All of the email was this long. Took me 5 seconds. Emailed them back. They wanted artwork, they wanted clinical trial data, they wanted a certificate of conformity, they wanted all of this stuff, and we did it, and it got released the next day. And it makes me wonder, how are these companies who aren't compliant like that, how the bloody hell are they getting through it? Do they just go, oh, it doesn't matter, then you keep it, you keep that product? I'm like, no, that's 100 grand's worth of product, I want it. But we turned it around really quickly and it got released. So trust, transparency, anything anybody needs from us, you've got it. You can. How long the delay was? Well, there was a delay with the manufacturer anyway, so it took ages to get into the country. And then when it got into the country, because what happens is Border Force take it, and they did a document check. So I think they had it for about 4 or 5 days in total. They took it, did a document check, so we fired off all the documents that they needed, and then they went, I'm really sorry, your document check's passed, but now it's moved on, and they've gone to take it to business trading and standards. We need your artwork, we need your clinical trial, because they are actually looking. This is what I'm saying. The UK are clamping down.
Making all these claims about us, and you just sit there and got the proof.
Look, we've got the proof because we did the trial, but.
Like 2 weeks?
No, not quite 2 weeks. No, about 10 days generally, because, yeah. Well, the last time they did it, 3 weeks they had it, and they opened every single box, because every box came back in with Border Force tape on it. Every single box. I mean, it was only one pallet, but every single box had been opened. But this time, I think because, and this is why I say to you to make sure your processes are in place and you've got your documentation, and if somebody wants something, you need to be able to give it to them straight away. I went back to that email within about 7 minutes, and they released it the next day, and they'd not even unwrapped the pallet, because they trusted what I was doing. And I went, actually, I mean, when we sent the documentation originally, they came back and went, oh, we've gone through your website, thank you very much, that's brilliant, artwork all looks fine, you're on the system, it's all good. What about this claim? And they'd been through the website and found this claim, and we went, right, there you go, right, there's your clinical trial done. And like I said, that prevented them then from having to open all the boxes. But not every company could do that. But we've got, like I said, good quality team. The quality team, well, they should be able to, yeah, exactly. You should be able to do that. Yeah, 100% you should be able to. So, yeah, stay informed. Obviously, with, like I said, our quality team, my team, the operations team, is bigger than the sales team in this company. But that's because we want to be compliant. We need to be legal. We want to be that good company where actually we've got room to grow. If we take on 500 employees, we're fine. We'll be absolutely fine, and we can retire then, Sissy. So yeah, thank you very much for your time. I'm sorry, I know it's a bit boring, but it's really important.